Welcome to a conversation with world-renowned plastic surgeon Dr. Richard W. Fleming.
Many people are concerned about unwanted fat deposits that they cannot lose despite good nutritional habits, dieting, or exercise. The reason they have problems is the number and location of our fat cells is constant after puberty. People increase or decrease the size of those cells when they gain or lose weight. So if you have an excessive number of fat cells in a specific location, regardless of your weight, you're going to have an unwanted contour in that location. So what liposuction does is remove some of those unwanted cells to improve the contour of the body. Liposuction can be used all over the body. We use it in the neck, under the chin, frequently do it in the abdomen, the hips, the thighs, the knees, the calves, the ankles. I mean, basically the whole body. And it is different among men and women. Women, classically, the most common areas they have problems are the lower abdomen, the hips, and outside the thighs, the saddlebag area. For men, it's the abdomen and the proverbial love handles that can cause them a lot of distress. What we're doing with liposuction is we remove those cells through a small tube placed in a tiny incision in a natural skin crease. That incision is typically 1/4 of an inch to 1/2 an inch in length. And that tube, that cannula, is hooked up to a high vacuum suction. And literally the suction removes those unwanted fat cells. We want to have a smooth contour when we're done. We want to leave some fat. We do not remove all the fat because fat forms a normal, natural barrier in an Olympic athlete between the skin and the underlying muscle. So it's important that we leave some fat behind. It's not just blindly removing as much as we can. So it's important that we contour it so we avoid any irregularities in the skin surface or dimpling afterwards. And with some techniques, it is more difficult to avoid that post-operative complication. After surgery, they're going to have short-lived and truly minimal pain, which is easily controlled for the first 24 to 48 hours. They will wear a pressure garment afterwards because we want to keep the skin attached to the deeper tissues, and the pressure garment will also help the skin to contract down to the new shape. Patient will probably have some bruising, and that can last a week or two. It's minimal but does occur. Because there's naturally swelling after the surgery, the significant improvement is really not going to be seen for 6 to 8 weeks. The reason that liposuction is not as painful today is primarily the fact that we're able to loosen the fat before removing it. It's not as traumatic as it was when we first started doing it 20 or 25 years ago. We use a PAL technique, as I mentioned, that will, with vibration, break up the fat before we remove it. So it's not as traumatic to the patient. Bruising is less, swelling is less, and pain is really about swelling. That's what causes the pain. So with less swelling, patient has less discomfort. The best candidates for liposuction are those who are in good condition. Basically, they're in good health. Liposuction is for contouring. It's not for treatment of obesity. Just not. It's a matter of subtleties. It's a matter of refinement. Years ago, when we first started doing the procedure, it was developed by surgeons in France. 25 years or so ago, when we first started doing it, we did people who were very heavy. They were obese. They were overweight. While initially we got good results, they didn't last because the patient went right back to their old habits of poor nutrition, not exercising, not taking care of themselves. So we have learned and continue to do only those people that are in basically good condition, have good skin tone, and have taken care of themselves. And we use this only as a technique to remove unwanted body contours.